Hey there, it's Dr. Jim. Thanks for stopping by because I have a really important topic and one that I hope a lot of healthcare professionals watch and then forward and share it with your colleagues and your friends out there. It's coronavirus, COVID-19, and I'd like to talk about prevention and treatment. These are really important issues and topics, and everything that I'm about to share with you comes directly from the CDC. So COVID-19 is a respiratory illness that was first identified in Wuhan, China, and now has spread from person to person globally and here in the United States. While there's been numerous deaths reported, it's important to remember that the vast majority have been in mainland China. Other countries are now infected, including Iran, Italy, Japan, and I'm sure there's going to be others as we watch the media. Risk of infection is greater for people who have come into contact with someone known to have the virus. Those who have recently traveled to countries with high rates of infection may also be at an increased risk for contracting the virus. Now, how it spreads, there's a theory that it began with some type of animal source and now is spread from person to person through close contact, which is about 6 feet away, through respiratory droplets from an infected person when they cough or sneeze. Although touching an object that has the virus on it and then touching one's mouth, nose, or eyes can transmit the virus from person to person, this is generally not how it's being spread. Symptoms: people with COVID-19 have mild to severe respiratory illness. The 3 hallmark symptoms are fever, cough, and shortness of breath. According to the CDC, there are guidelines for general prevention, preventing the introduction of the germs into a facility, preventing spread within a facility or between facilities, and then for protecting yourself. So in terms of general prevention, the CDC indicate that the best way to prevent illness is by avoiding being exposed to the virus in the first place. Everyday means of prevention are recommended to prevent the spread of the virus as well as other respiratory illnesses. Some methods of prevention include things like avoiding close contact with people who are sick, avoiding touching your mouth, your nose, and your eyes. If you're sick, stay home. Cover your cough or your sneeze with a tissue, throw it away. Clean and disinfect surfaces that are frequently touched. Practice effective and regular hand washing. That's a big one, an easy one, and one that's so easy to forget as well. And then use hand sanitizer that contains at least 60% alcohol. The whole face mask thing, when we see people on television, they're wearing face masks. The CDC actually recommends that if you are not sick, if you are asymptomatic, don't wear a mask. On the other hand, if you are ill, and for those people who are sick, if they can tolerate wearing a mask, the CDC does recommend that. To prevent the spread within a facility, we have to inform staff, residents, and families of the current situation. Residents and staff should be monitored for fever, cough, shortness of breath, and related respiratory symptoms. And again, if tolerated, have residents, family, or staff wear face masks if they're sick. It is equally important to go back to the basics and practice universal precautions and standard contact and droplet precautions. Monitor local and state public health sources and consult with public health authorities. Support hand and respiratory hygiene and cough etiquette in your care community. Have enough alcohol-based hand sanitizer around. Make sure that there are plenty of tissues so people can use them and discard them. Identify a dedicated staff member to lead the care for residents who do have COVID-19, and they can also provide ongoing infection control training and education. That's important. Post signs on residents' doors if personal protective equipment is needed. Make sure that you have the right equipment, including gloves, face masks, gowns, and eye protection available. Keep trash cans in the residence room and keep them outside of the residence room. Just make sure they're handy. To prevent illness between facilities, it's important to make sure that the facility receiving a resident knows that they have COVID-19 and that they're well informed and that they could handle the situation after the transfer. And then, of course, report any possible COVID-19 in residents and staff to local health departments. Now, how do you protect yourself? The best way to protect yourself is to avoid contact with others who are sick and symptomatic. Don't touch objects that might be infected, and then touch your eyes and your nose and your mouth. Wash your hands routinely and effectively, which means long enough. Sing happy birthday, and you're good. If sick, stay home. Cover coughs, cover sneezes. Use household products to clean and disinfect frequently touched objects like light switches, door handles, countertops. Quarantine time might be up to 2 weeks if you've traveled somewhere where there's a high rate of COVID-19 and then you're returning. If current symptoms with fever, cough, difficulty breathing occur, you have to contact somebody. Contact a healthcare provider immediately and then inform them that you might have the illness. You're not sure, but they're going to give you instructions on how to get to the facility, the care facility, the ER, the hospital, without infecting other people along the way. That's extremely important. Treatment, unfortunately, right now, at the time of this filming, there is no vaccine and there's no specific antiviral treatment for COVID-19. People who are sick will receive supportive care, and for severe cases, treatment will include care to support their vital organ functions. Last note before I go, if you or someone you know has been exposed to COVID-19, is showing signs or symptoms, have a fever, cough, or shortness of breath, don't wait. Contact a healthcare provider immediately. I'm Dr. Jim. Thanks for your time, and keep your eyes out for COVID-19. GoPro, stop.